It didn't start overnight, obviously. It started at the age of, I would say around 12 or 13 with my first drink. Life just spiraled downhill quickly. My drug of choice was cocaine. It was the birth of my first daughter, and I had to get through the birth of my daughter by being on drugs. I was strung out on cocaine, but when I held that baby in my arms, it was like I was no longer alone. A couple months later, I sought recovery, but for the grace of God, I've been able to maintain that since.
Early on in the Foundation's work in substance abuse, we recognized that we didn't know nearly as much as we should have about very fundamental questions of substance abuse.
The prolonged exposure to substances, alcohol, cocaine, heroin, changes the brain. When you are able to see that through brain imaging science, you can't help but change your view of the person with the addiction problem.
This is a disease just like any other disease, whether it's diabetes, whether it's cancer, whether it's hypertension. It can be treated.
This is the only physical condition or illness or disease where a lot of the blame is put on the person.
Our goal was to try to reduce the stigma that was linked to people who had problems with substance abuse. They were genuine human beings and they really deserved help as much as someone with cancer or heart disease.
I'd rather have heart disease. That way you wouldn't look at me with shame.
We know that nicotine's addictive. We know that alcohol's addictive. We know that many drugs are addictive. So you can't just tell an addict not to be an addict anymore. You have to build in the environmental supports so that person can start walking down that road to recovery.
You just have to hope that more and more research, more and more findings will come about that will enable science and medicine to help heal the brain.
We have science in the addiction field which helps us understand that addiction is a brain disease. It's begun by a behavior. We know a lot more than we did back in the 1980s. So science has caught up. Science is a major asset.
To have a foundation like the Robert Wood Johnson Foundation involved in trying to stimulate new ideas and medicalizing the approach. We needed strategies.
We were able to get interest in substance abuse out in the communities. And all of a sudden, foundations all across the country who hadn't thought that substance abuse was a problem worth really talking about or supporting were finding good programs in their communities. And I think that worked well.
When you have that level of engagement on people at the grassroots level, and you marry that to the resources a national organization can bring, you have the greatest success.
What started out with just 2 or 3 people has now grown into a coalition of over 25 organizations representing thousands of professionals in a variety of fields.
Now, there's these organizations surfacing all over the country, recovery community organizations that are helping to reestablish that connection between treatment and long-term recovery.
I know we'll start with alcohol. I'm just not sure how it's going to end.
You do not have a community-level strategy, and if you do not have community institutions building the support networks, successful expansion of recovery is really impossible.
Reclaiming Futures was our flagship program in addressing adolescent addiction. One of my favorite success stories is about a young woman from our Seattle site for Reclaiming Futures. She was asked for the first time, how can we help connect you to the things that you love doing over and above all of the other service stuff that she needed? Today, she's in college. And she says that she hopes to be a judge because the judge in that site so inspired her that she wants to do the same for young people.
I came up with the concept of CASA. If RWJ had not had an interest in substance abuse, we wouldn't have been able to do it.
The foundation gave an early grant to Faces and Voices of Recovery. And these are groups of people in recovery from various different kinds of philosophical standpoints. They don't all agree about what recovery is, but at least they're willing to talk about it and they're willing to put a face to it.
Robert Wood Johnson also funded a project called Advancing Recovery that looked at how states and the centers can work together to implement practices.
The Network for the Improvement of Addiction Treatment, or NIATEX, is probably one of the most innovative approaches that has come out of a collaboration between the Foundation and the Substance Abuse and Mental Health Services Administration.
The Foundation funded a number of states to organize coalitions statewide to change the environment around youth access to alcohol.
We took very much an environmental approach where, with a matter of degree, we worked with college campuses to change really policies and the environment around drinking on college campuses.
Robert Wood Johnson Foundation resources allowed us to plan and launch the campaign for alcohol-free sports television.
We found a lot of champions out there who were previously unheralded, and we were able to give them a microphone and amplify their own voices.
I promise to stay in school and learn the things I need to know to make the world a better place for kids like me to grow.
I promise to keep my dreams alive and be all I can be.
Substance abuse in its totality impacts every area of life throughout our communities.
When the Robert Wood Johnson Foundation made the initial investment in substance abuse policy research, there was a dearth of scientific knowledge around drugs, tobacco, and alcohol.
We are 5% of the world's population. We consume 2/3 of the world's illegal drugs in the United States.
We decided first with smoking, and then we broadened it out to all substances to try to lure senior and junior researchers in to ask very critical questions about substance abuse.
I believe that this is the most important single social issue in the country.
It was extremely helpful to me in changing my views from seeing the war on drugs as primarily a crime war to primarily a public health war. To have a foundation like the Robert Wood Johnson Foundation involved in trying to stimulate new ideas and encouraging people to rethink their approach.
What would you do if a stranger talked to you?
I wouldn't talk to them because it might be bad.
What did your mommy tell you about drugs?
Your children are listening. Are you talking?
By the late 1980s, we had figured out that individual behavior change, working to prevent substance use or treat it one individual at a time, wasn't working. We needed to change the environments in which people lived and worked and played in order to change their behaviors, to support healthy behaviors.
We survey 12 to 17-year-old teens every year. Kids who always had dinner with their parents were far less likely to smoke, drink, or use drugs than kids who never had dinner with their parents.
There's very clear evidence that the price that people pay for a drink influences whether they drink and influences how much they drink. Research in that area has been supported by the Foundation.
If you got mainstream medical researchers who study heart disease, hypertension, diabetes, and they looked at the literature in terms of what was the effect on a patient with diabetes if they drank a little bit too much. That program showed that drinking and drug use had a huge effect on physicians' ability to treat chronic illness.
Robert Wood Johnson was very critical, I think, in the tobacco response, and also played an important role in alcohol and illicit drugs.
We started focusing on kids and discovered quite quickly with very good research that if you raise tobacco taxes, you would keep kids from starting to smoke. We affected tobacco tax increases in many, many states around the country. And we learned that you can use research and then affect policy change.
We found that higher prices were very effective in reducing youth tobacco use.
Because of the work of RWJF in this field of addictions, people know to go to the research.
Good research can inform policy, and through that, you can change the way people's lives are lived.
Marijuana use was very high in the late 70s, and about 1980 it turned around and started down. And we were able to track the fact that this was largely because young people came to see it as dangerous to use marijuana. That was when we first really got evidence that perceived risk was a determinant of what young people did in the drug abuse area.
Probably the biggest service the foundation did in messaging was just continuing to beat the drum that this is an important issue, substance abuse. And so we tried in multiple different ways to try to do that, whether it was TV programs or whether it was meeting with people who held great influence.
They say one of the surest ways to get your message across is to put celebrities in your commercial. We hope they're right.
They gave us access to communication approaches and different public relations approaches that really helped us spread the word, so that currently we've worked with, over the past 5 years, 1,000 different addiction treatment organizations.
One of the first things that the foundation did for my staff was they sent in a professional trainer who's a media consultant in the White House to help us frame our issues, to look at how we speak before the media.
A new report out tonight shows a disturbing increase in the intensity of drinking and drug taking on our college campuses.
The Surgeon General picked up on this and made the reduction of college binge drinking a major national priority. All the networks had as their first news item the results of the study.
Researchers at Harvard University have released the largest study of its kind on what is called binge drinking.
When Henry Wechsler first started talking about college student binge drinking, this phenomenon that has been going on for decades, but all of a sudden we have a name for it.
We stood back, we looked at our niche in this field, and we realized that we could uniquely focus on identifying and then implementing policy changes that would affect entire populations, not one individual at a time.
The foundation put a very explicit emphasis on creating those connections, doing the research, but then making the implications clear in terms of what does a policymaker, what does a governor need to know, what does a mayor need to know, what do the legislators need to know when they're debating an issue.
In drugs and alcohol and tobacco, public policymakers have had a fantastic impact.
By bringing together the science with our communications work to ensure that the science not only got produced and printed in journals read by a few academics, but got read by policymakers who were making critical decisions, we were able to bring together what I call the three critical prongs: rigorous science, effective communications that reaches decision makers, the media, and the public, and policy advocacy with proven solutions.
You need to have your politics, you need to have your research, and you need to have your people all together. You can't have any one of the three if you're going to have efficient social change.
They really created a generation of policy researchers that wouldn't have existed otherwise.
What is so exciting now is that there is a huge amount of data, good scientific studies that have been funded by the Robert Wood Johnson Foundation that shed important light on the key policy issues that affect Americans.
What was found in the research was found. Now it's knowledge, and now it's things that the rest of society can continue to use and rely on as they go forward making these decisions.